Wonderful, wonderful. Well, hello everyone. My name is Stephanie Austin. I'm trying to see with the camera. Okay, Stephanie Austin. I am the executive director of Global Chamber Dallas Fort Worth. It's a pleasure for you all to be here today. So we usually say good morning, good evening, good afternoon, because we have people hailing from all over the world with us today. And I'm so excited about the topic that we're going to discuss, but especially excited about our guest, one of our guest presenter today. A few housekeeping rules. If you can put your phone your device on mute, so therefore if someone's talking, everyone will be able to hear. That'll work out well. If you have any questions, please raise your hand or put it in the chat. We'll definitely not overlook that. And also share your information. We would love to know who you are, how to reach you. Put a little pitch in there about what your business that you do, so that people that are here today will be able to connect with you, especially if you have a LinkedIn profile. That will be great. So again, as I mentioned, my name is Stephanie Austin, and I'm the Executive Director of Global Chamber Dallas Fort Worth. I'm also the CEO of Austin Global Solutions, which I provide consulting service from a healthcare perspective, as well as a call center if people need call center support or administrative support. But enough about me. I want to talk a little bit to you about what Global Chamber is for those who do not know. So many people are like, well, Stephanie, what's a global chamber? I mean, what's the difference from the chamber that I have here locally in my city? And that's just it. We're not just a local chamber, we're a global chamber. We're in 525 metros, 195 countries. So when you are a member of one particular chapter, you are a member of all. We have warm connections. We connect people across the globe and make it feel like you're connecting with people right across the street. We cross-border trade. We're in investment in every region of the world by engaging top executives and leaders with warm connections, as well as entrepreneurs. So that's what Global Chamber is in a nutshell. I wanted to be fast and furious and share that. I wanted to also share with you all our Global Chamber Dallas Fort Worth, our advisory board members. And we have a couple of them on here today. As you met myself, Stephanie. Anthony Piccolo is our advisory board chair. Jacob Dietz is advisory board member. Nelson Alvarado. We have Jennifer Thornton, who's one of our advisory board members as well. We have Jean Gardes Moviston, is known as Dede. We have Stephanie Harris, who's also one of our board members. Jeff Papas, Prosper Jetty, Michael Wesley Walker, and we also have Diana Uratia. I want to make sure I pronounced it correctly. And so these are just our board members, advisory board members. We definitely have more opportunity for people to be a part of our advisory board. We like them to be members, understand what Global Chamber is before they dive just straight in. And so today you're here for this call today. You're here to talk with us about the changing face of healthcare. What's ahead for providers and teams? And I have the pleasure of introducing Dr. Muhammad. And so Dr. Muhammad, I'm going to put it here. He's here with us today. Dr. Muhammad to Kaba. His last name is Kaba, but I call him Dr. Muhammad. He's dedicated to public health. Specialist from Republic of Guinea, West Africa, with over 10 years of experience in leading complex immunization. Now, we all know that health is very important. And I believe Laura and Barry spoke about it today. Just a little nugget, just a little nugget. They talked about it also in your thinking. And so you all make sure you connect with Larry and Barry. I mean, Laura and Barry, you have to, because you missed a nugget today and they can share some things with you. It's a shameless plug. They didn't tell me to do that, but I happen to be involved today with the Global Chamber London. And to tell you the truth, Laura, I needed that today. That gave me a pick me up. So thank you. In regards to Dr. Muhammad, he's also a Mandela Fellow, Washington Fellow. We, as Global Chamber, we partnered very closely with the Mandela Washington Fellows, the Young African Leaders Initiative, and he's in the initiative for the alumni. He studied leadership and public management at Arizona State University, which is where our corporate office is in Arizona. Dr. Kaba is a proven track record of strengthening immunization programs and has served as an immunization officer in 10 countries across Africa. His qualifications include a doctorate in medicine, a master's degree in public health, and an advanced postgraduate diploma in clinical research and pharmacovigilance. He's here in the United States right now. Dr. Kaba is fluent in 2 languages and committed to promoting vaccines and protecting children from deadly diseases across Africa. He is dedicated to ensuring that no one is left behind to fight against preventable diseases. So I'm really excited about that. I met with Dr. Cobb and I spoke last week, and he's just a phenomenal person. My background, I have 30 plus years of experience in healthcare as well. So him and I will be talking about healthcare, the changing face of healthcare together. So Dr. Cobb, without further ado, I'm going to pass the baton to you. And then again, if anyone has any question, please feel free to drop it in the chat. Dr. Kaba?
Okay, thank you, Stephanie. Thank you for this opportunity to be a speaker today. Good day, everyone. I'm Mohamed Tukaba. Stephanie has already said everything about me. So I'm excited to be here and to discuss this relevant topic, which is the changing face of healthcare. What can be happen for providers and teams in the next few years. So I thank you. I don't know if we can continue now or if
Yes, you can go ahead.
Great. So this topic is very relevant and it is very important because today, if we notice that a rapid transformation due to technology development and also patient expectations has been changing every day, and also the policy framework are changing in every countries, every state. So all these aspects are today are contributing to be the major changing occurring in the healthcare industry. So these transformations will significantly impact and redefine the way the healthcare providers and their teams deliver care. So in that case, if we want to go further, we need to focus on some points like technology integrations and innovations. So if I speak fast, please, I can.
You're doing just fine.
Okay, good. So I said that the first point is technology integrations and innovations. So this point is very important. We can discuss about the telemedicine or telehealth or virtual care. So the virtual care era saw an explosion during the COVID-19 pandemic. We all noticed that, and is still being using today, is still growing. So the virtual care will be increasingly used by healthcare providers, in the next years for consultations, for follow-ups, and chronic disease conditions. Has this disease has is a life cause disease. So in that case, virtual care increases accessibility. We have accessibility and also equity to healthcare industry. It improves what we call patient health and reduce the cost related to the patient movement, leaving home, traveling to the emergency room services, and also spending a lot of time waiting for the healthcare providers. So in that case, according to Harvard's Business Review, today 78% of adults who own a smartphone, especially those who are living in underserved areas, have access to healthcare services thanks to the virtual care. So I provided support in many countries in Africa. There are a lot of countries that if you really need the care, you need to travel thousands miles to see a specialist. Today, within 10 minutes, within 30 minutes, you can just access to a specialist wherever you are. So this is the first point, why it is very important to use the telemedicine. It is very important that the healthcare providers has to adapt to the technology integrations in innovations in the next few years. I have two reasons. The reasons, one is it can reduce what we call the cost and save time both for patients and the physicians. If you go to the hospital to go to the specialized department, you need first to pass by emergency service room. Then they will direct you to the specialized department. So at emergency room department, the cost are 12 times more expensive than saying directly a physician's office. So that is the first reason that it will be very important to adapt to the telemedicine, to the technology advancement in the next few years. And also the second reason is virtual care can reduce what we call the disparities, between state, between regions, between the districts. So as I said previously, there are some countries. Okay, example in the US during the COVID-19 pandemic, it was critical. It was very difficult for some people who needed care to go to the hospital. Then the best approach was to use what we call a virtual care. So most of them received the advice from their providers directly according to the virtual care. So in Africa, for example, um, there are some referral specialties. You can't access it when you are in some part of the countries apart only the capital. So you need to travel, and the roads are very bad. You need to travel thousands of miles to access those services. Then today, you can stay in your districts with your smartphone connected, and then be connected directly to a specialist and get the advice, prescriptions, and then you can go to the pharmacy without even traveling. These two reasons can really boost healthcare providers and also health policies to adapt to the new era. So this is the first point about technology integrations and innovations, what we call telemedicine or telehealth, or again, virtual care. So if I can stop here if you have any question before I go to the second point, or if we can go directly and then finish the discussions at the same time.
Well, let's pause here just a little bit for anyone that may want to add or have a comment. And I do want to add, but I would like to see if does anyone have any comments or discussion? Nima, I see that you raised your hand. Feel free to pop on, and would love to see your lovely face if you're able to do so.
I'm so sorry I cannot put it on because of network. I
No
cannot put
problem.
on my video. Yeah. But
No problem.
thank you so much, Doctor, for your presentation. I just wanted to add just few things that we are going to using mobile phones, but we have already, for example, here in Tanzania, we've started seeing this happening. For example, healthcare providers using the mobile phones and smartphones to uh, do referrals from one facility to the other to start preparing for referrals, the emergencies that are occurring from one hospital to another. But also we're using now smartphones to like the pharmacies doing deliveries for the medicines instead of going far, and also some having uh, doctors using phones to diagnose from the doctors in the hospitals while a patient is at home, and just sending nurses to take samples and everything. So thank you so much, Doctor, for the well narrated presentation. So,
Thank
I'm from Tanzania.
you. Thank you so much, Nima. Did anyone else have a question or comment they want to raise at this time? Okay,
Yeah,
so
Prosper here. I have a question.
hey, Prosper, how are you? That's one of
Good.
one of our other advisory board members for Global Chamber Dallas Fort Worth. Good to see you, Prosper.
Good to see you. Sorry, I had some network issues. I'm actually out of town right now. I'm
No
on a client side. So, um, yeah, I think thank Doctor for a nice presentation. And I just wanted to ask, like, I mean, with what the doctor just mentioned, it does look like, there is need for the infrastructure, especially the technological infrastructure to be available, right? So I'm not sure in terms of, where you mentioned maybe things going on in terms of that telemedicine or something like that in Africa. Do you think that there is enough infrastructure to kind of scale it to so many other areas that can probably right now wouldn't be reachable? And number two, so is there a need to probably partner with some other technological investors so that at least they can invest in infrastructure as well to broaden, healthcare access to so many other areas?
Dr. Kaba, he's asking you that question.
Yes, thank you so much for these questions. Thank you for the first one was the comments. Thank you for that. I've been also in Tanzania in I've been there in 2023. So this question is very important in Africa. Infrastructure will be one of the challenging aspects. The first one is you will need even internet. Internet will be difficult in most of the parts because it is very difficult to get access to the internet, and also even the different materials also will be more difficult to get in most of the country. But here, what you need is just to change the policy framework. So the government has to prioritize. It seems that a new area in most of the country in Africa. So that if really the government prioritize this aspect, I think that the challenges can be reduced. But for now, the challenges is very high. But it is not impossible to address the gaps between the current state and where we want to go. So the government has really put in their policy and priorities then I think that we can have solutions. It is it is a more cost effectiveness than if we invest on the patient from a place from a district to travel to the capital. I think that it is possible, and you're right. Your questions is really relevant and needed to be addressed together. Thank you. Over.
Absolutely. Thank you so much, Dr. Kaba. Also, I want to speak a little bit in regard to the changing face of healthcare and also telemedicine and telehealth here in the US. And so, working 20 plus years, I don't want to tell my age, I've seen a lot, in regards to telehealth, implementing it in the healthcare systems, large healthcare systems. I've been a part of the implementation, training physicians, training nursing staff and mid-levels. And if you all can recall before COVID, providers did not want to do telemedicine. They did not. They felt that they need to see the patient, they need to put their hand on the patient. That not all, but some, many of them did not want to do that, nor did the insurance company want to pay for it at all. The insurance company had pushed back, and during that time prior to COVID, we were having patients who either lived too far, didn't have transportation, that really needed that service. Once COVID came, telemedicine, telehealth, and the insurance companies became very interested, and now they were on board with doing this. So just imagine now, that was what COVID was like 4 years ago. Now look how we're shifting with AI in so many aspects. And so what's ahead for providers and teams? I've spoken to some providers who said it seems like more work, because when you have more artificial intelligence or computer, it appears to be more work at time, and it is, because either you're having to do more charting later at night or in the evenings. And we're hoping with the change coming forward with artificial intelligence that may be more streamlined. What I will say, continue following Global Chamber Healthcare. We have several topics that's coming up next year, 8 topics that we're going to talk about. That's going to talk about how do we navigate the waters here globally with healthcare from within the US, across the pond, in every state, every organization. And your input is valuable. If you're not a provider, you've been a patient. If you haven't been a patient, a family member has been a patient. What you've seen, what you would like to know more about. So I just wanted to share about how it has changed. It has impacted our providers here. And when I say teams, it's the clinical team, whether it's the nursing staff, your medical assistant, your front office staff, your billing, your collection. It impacts as a whole. So I'm going to pass the baton back over to Dr. Kaba so he can talk about his next topic. Definitely would like to do that. Someone asked about what is your take on universal coverage? We're going to save that one last, because that's a big one. We'll save that one last, Nima. So don't hang up. You got to hang on here until 1:30. Dr. Kaba, you want to go ahead next for the next one?
Okay, I will go to the next one quickly. The next topic will be artificial intelligence, AI. As we all know that also it's a new era, but currently we know that AI has immense potential to revolutionize the healthcare industry. And in coming years, AI will be an essential tools in the healthcare sectors, and its use is advancing very fast, growing, and has the potential to upgrade to advance healthcare outcomes by improving the results of the trials, and also medical diagnostic and treatment, and also self-care management. With the AI, patient can manage himself by generating the different results that he really needs to read. So today, for instance, if we try to see IBM Watson Health, that's uses AI to analyze the different data. I mean, amount of data of healthcare sectors, helping doctors to make more accurate diagnostic, to make decisions about the treatment, about the outcomes, and also plans all the treatments. I mean, to make all the treatment plans. Also, if we one of the example that also it is AI tools like Google Health AI algorithm are being used for early detections of disease such as breast cancer and high conditions through medical imaging analysis, improving early diagnostic and patient outcomes. So this one, we have also the same challenge in Africa. As I explained previously, it's a really challenge, but using AI, we have some challenges that we can encounter in the health sectors. The first one is the data privacy and the security. If you really want to implement this aspect, it is one of the challenges that we can encounter, because AI has the ability to handle sensitive and confidential data. Patient data include personal, financial, medical informations, and protecting from security breaches and unauthorized access is very crucial. The other challenge is bias and fairness. Okay, um, existing human bias in the data they are trained on, AI can exacerbate. I mean, uh, can amend the result. For example, if the training data is especially based on the demographic components, the AI system may perform poorly or make biased decision regarding underrepresented groups. Other challenges is also we have ethical considerations. This component is very important. That makes in October 2023, WHO has released a publication entitled Regulations Considerations on AI for Health. Because ethical considerations is very important, the use of AI in health sectors has raised many questions about it, particularly around consent and autonomy. Because in the traditional health sectors practice, patients should be informed about how their data is used and have the option to consent or decline the use of AI in their care. But if we use AI can access directly to the patient's data, and I can interpret and also give anyone directly, even receiving the consent or not from the patient. So those are the challenges that we can face when we are implementing the AI. So it will be also one of the critical points in Africa, because it is a new era. We don't know it. We are just learning from it, and also the healthcare industries has to adapt and also start learning from AI, because it can give really accurate diagnostic and also treatment plans. So the last point regarding technology and innovations is the watches, wearable health devices. Wearable health devices are electronic devices that we can use. So those devices can detect or can collect health data when we are using. They can be used to monitor vital signs. I mean health parameters. Vital signs assist with diagnostic and also help patients manage chronic conditions. If we use it, track it can track our health fitness a day, what we are doing. It can also monitor our blood pressure, our sugar levels, electronic cardiogram, ECG monitors, blood oxygen levels. So these devices allows continuous tracking of health metrics, allowing patients to share real data with healthcare providers for better informed and treatment decisions. So as these devices are becoming more and more advanced, they will help detect potential health issues earlier and potentially preventing major health events like heart attack or strokes. So as we don't have enough time, I will also give the floor if anyone has a comment or questions about this component.
So while people go ahead and raise their hand or put their question or unmute, a couple of comments I wanted to say, Dr. Kaba. One in regards to artificial intelligence, right? You mentioned artificial intelligence has helped with discharge planning or probably helping with diagnosis. What are some of the other things? So that's one question that you've seen AI. Another question that that's been posed several times is that, do we see AI taking over or replacing physicians or replacing nurses or replacing the front staff? And I have some comments and thoughts about that, but I would love to hear your response in regards to that. And as you mentioned, also there's devices, and I believe Laura mentioned that devices she uses Whoop, and there's a watch that I wear also that does your heart and monitoring. I know people that have even the little small EKG machine things that they have at the house, and they put their 2 fingers on there. So where do you think there's still a place for providers, or is it going to shift the providers' care to do something differently? What are your thoughts? Are you there, Dr. Kaba?
Yes, I'm here.
Oh, okay.
Um,
I know I
could-
had a lot of questions. So for the first
yes,
question, let's just start
yes,
with the first question. The
okay.
first question, do you think AI is going to replace our providers and our clinical teams?
Okay, that is a good question. Now it will be a very difficult this moment that AI can. That is my personal uh, views. It will be difficult for AI this moment to replace healthcare providers because, as I said, one of the challenge that HEYAs can also generate what we mean bias and fairness. That is why it will be difficult this moment that AI replace health providers. I mean that AI can exacerbate exacting human bias in the data they are trained on. This is the first point. The second point is regulations component. AI cannot replace human because regulations can lag behind the products and devices they need to regulate. So there is a little balance between holding back innovations of life science organizations to keep people and allow devices and products to enter the market so they can benefit. Now, for many reasons, there are some decisions women, I mean health providers can be more and even if AI produce or generate a decisions, women healthcare providers has to analyze the decisions, cannot take everything that AI as produced or as generate. So human beings has to analyze it and also to identify it, what is good, what is bad. I mean, where is the bias and where is the fairness, and then to separate the results and then to use the accurate one. So for now, it will be difficult for AI to replace healthcare providers. That
Thank you
is my,
so,
yeah, that is my view.
thank you so much. Jacob, do you mind, did he leave me? Oh, there you go. Jacob, do you mind, I'm speaking to the comment that you made? Oh,
Oh,
he said, he got you.
yeah. So no, yeah, I mean, I'm far
Oh,
from an expert, but this is a company that I connected with that I also learned that, through this group that um I was looking up a research paper for it, but how a lot of wearables, that there's a pigmentation challenge. People of color were getting wrong, like, blood oxygen level readings during COVID, or that led to a lot of misdiagnosis due to possible, with these devices not being able to account for skin color. And so this is a group that they've been building this for a while, and um yeah, it's pretty spectacular what all, I mean, like what they say is, like, it's like having a hospital on your finger in a lot of ways. Like, it's not, can't perform surgery on you, but like, you can get all of these amazing readings.
absolutely. Jacob leads out our Global Chamber Artificial Intelligence meeting once a month. So he's typically privy to many artificial intelligence initiatives that's going on. Laura, did you have a comment? I saw you had something there. Did you want to speak to that at all? I know you're coming off on mute. There you go.
Yeah, no, it's interesting, thinking about AI. I'm obviously been in the health industry, looking at people's stress and burnout and stuff. We use a lot of these watches with them for sleep, for recovery, for strain, that kind of stuff. But I don't think it'll ever replace nurses, doctors, that kind of thing, because there's so many different variables. So for example, I've got heavily tattooed skin, and I have to put a bit of plastic on the back of an Apple Watch for it to be able to read my my stats and everything. So there's always going to be different variables when you're looking at somebody. When you are with a doctor or a nurse, within that healthcare profession, all those variables are covered. Whereas, when you are wearing something, AI generated, I think it's wise to, yes, listen to it, but take it with a pinch of salt, I think, as well.
Absolutely. Absolutely. Thank you so much. Emily, I know that you didn't know I was going to call you to the front, for the forefront. Emily, I've known her. She's in Charlotte, North Carolina for a very long time as a rep. She's a pharmaceutical rep. And I guess my question to you, Emily, well, how have you seen AI impact the pharmaceutical organizations?
Yeah, it's definitely a bigger component in the last just even year, in terms of how we're gathering information, how we are approaching business, the ways that we communicate with customers, and it's fascinating. I'm so glad y'all touched on this subject, because I was curious how it impacts everybody across the board and what this really means for the future.
Absolutely, absolutely. The one thing that I like to share that you mentioned, Dr. Kaba, in regards to Africa, but also I'm going to apply it here in the US, is regards that sometimes we have people that are in remote areas. As a matter of fact, I spoke to several patients today And they were saying that their challenge is that their doctor is not on their plan, the pharmacy is far, and with different technology, you can say AR, but as a drone, there's able to deliver medicine to their homes, right? And so this is so far different from when I was growing up, many, many, many moons ago, where, you now have medication being delivered via drones. You have patients who now can see their provider and talk to them on the phone or on their laptop or on their computer. And, that is definitely a benefit for people or patients who are not able to get out. So I just wanted to kind of share that. Another question someone brought up here, and I'm going to have her to ask that question. I think it was Nima. Is she still here? Nima, are you still here? Yes, you are. Nima, you're going to have to unmute to ask that question that I said we will definitely ask it at the end.
Yes, thank you so much. I'm just we in Africa right now, it's the message is universal coverage, and I just wanted to know from the doctor and his experience, what is his take on this, with the change of technology and the universal coverage. We have a lot going on to, from the infrastructure and everything. What is his take? And also, there's someone in who has just joined who is doing a research on that. I think he's going to ask more questions after this.
So I guess your question, I just want to rephrase it. You want to know, what is Dr. Kaba's take on universal care? Is that what's the question you were asking?
Universal coverage.
Coverage, universal coverage. What is your take on
Yes.
universal coverage, your opinion?
And all the technology and the, what he's talking about, the correlation between the two.
Okay.
Okay. Thank you, Nema, for your questions. It's a very good questions. Universal coverage and technology advancement. I mean, these two aspects are really correlated because, as I said, that technology advancements can reduce disparities between countries. So if we invest in the technology investment, that can accelerate to reach universal coverage goals in most of the countries. Because technology advancement can easily access to people in underserved communities. So in most of the countries, in most of our countries in Africa, there are a lot of places that less than, if we try to see the ratio, one doctor per 10,000, there are many places that we don't even have one specialized doctor for 10,000 people. So that is why investing these components will accelerate, will really accelerate to reach our universal coverage target in most of our countries. So these two components are really correlated. Thank you.
Thank you so much. Thank you so much, Dr. Kaba. So guys, we have about 14 minutes left, which is a lot of time that I wanted to kind of pause for a moment for anyone else who have more questions, but also for everyone to do a 30-second intro to who you are, a little bit about yourself and your business. And I figured we have about 16 people now. There was 20 that was in here in the room here. And so that we can get to know who you are. And if you have any questions, drop them in the chat and I'll ask them at the end. So we're going to start with you, Laura, because your face is right next to mine. So Laura, it is on you. Who are you? Tell us a 30-second spiel about yourself.
Yeah, so I'm Laura Ash. I'm a former police officer and counterterrorism intelligence officer turned health and wellbeing coach. I run my company together with my husband, Rock Solid Health, which is global, and we basically help business owners and organizations reduce stress and rehabilitate from burnout.
Wow, I need that. I heard it earlier today. You guys definitely need to get in touch with Laura and Barry. Elia, your picture is up next. I'm calling people who have live video up first. So Elia, you're there.
Thank you very much. My name is Elia Lumwago. I'm currently doing my master's in public health research with a background in health systems management. And I'm very, very happy to be here with you. And the great of all, I'm very happy that I have had some of the issues relating to universal coverage. And I'm doing the research focusing on universal health coverage in the perspective where financing. Currently, our country is trying to implement universal health insurance as a way to achieve universal health coverage, where everyone everywhere will access health services without suffering financial hardship. So my question is, because you were talking about technology, I want to ask how to leverage technology to increase enrollment in health insurance. Because in our country, up to now, for 2 decades of implementation of different health insurance schemes, only 15% of Tanzania have health insurance, 85% accessing health services by using out of pocket, which make them sometimes be pulled to poverty because of having to pay for health services. So how to use technology to achieve this? My research is focusing on how the country is prepared for this policy and also potential mechanism to engage the private sector to achieve this. So I'm very happy to join you. I want to talk about that. Thank you very much.
Wonderful. So what you can do, put the question in the chat. I need to make sure I get through everyone for introductions, and we'll definitely get to that. So put your question in the chat and we'll answer it right at the end. 30 seconds. Emily, you're up. You're on mute if you're saying it. There you go.
Just got, sorry, that dug into my 30 seconds.
No, that's okay.
Emily Bogus, with just celebrated 24 years with AstraZeneca Pharmaceuticals. I'm based out of Charlotte, North Carolina, and Stephanie and I go back many years ago when she was in the area in the hospital system. But just my experience in pharmaceuticals, I've sold 14 medicines in 8 different disease states. But my desire is to continue learning and to have greater impact for the providers and clinical teams that I help, and then also to impact patients and their families.
Wonderful. Jacob.
Hey, yes, Jacob Dietz. I'm based in New York City at the moment, and my company, Climo Collective, does a lot of different things, but really looking at how to, different approaches to fundraising, reimagining, fundraising, do a lot through storytelling, project management, but a project that I'm working on, I'm really excited about, that Laura, we should chat about, is I'm leading partnerships for a global mental health task force, and so excited to take that on, and so I'm excited to be here with you all.
Wonderful. Thank you, Jacob. Michael, 30 seconds, everybody. You guys are doing well. You're doing good. We have time. Michael Walker. You're on mute. You're on mute. All right, we'll go to Sayali. Sayali.
Oh, I'm right here. I'm sorry.
Okay, I'll let you go, Michael, first.
Oh no, ladies first.
Sayali, go ahead, Sayali.
Oh, that's so nice of you. Myself, Siley. We at Aprili, a technology company where we help businesses to solve problems. We have worked in healthcare industry, and I see the pinpoint where there is so much of data. So I would like to add two points here. One is, especially when we are talking about different devices, we help with the IoT. We help to communicate between different devices and actual software processes to automate it. Also, the mobile devices deploy. We build mobile and web applications for it. So we recently worked with one of our healthcare industry who was building a platform for the different therapists to join and work together within an area to serve patients.
Oh.
And the second thing is, I know somebody who gives a real good next gen technology. It's a patented one for the zero trust policy for the persistent user authentication. So if anybody is interested in learning more about no security frauds, their full data protection for healthcare industry, feel free to reach out. I have posted my LinkedIn. Thank you so much.
Wonderful. Thank you, Sayali. Michael.
Hi, everyone. So my name is Michael Walker. I am with Austin Global Solutions. I'm an admin and project coordinator. And so what we do at Austin Global Solutions is we provide a lot of contact center support, digital marketing. We make sure we touch upon customer service, and we make sure your business model is efficient by just looking at all the back office tasks that you don't have time to focus on. And then we outsource them to people that are able to deliver on those tasks. And then you could focus on the bigger picture.
All right. Thank you, Michael. Ruby. Ruby. Saw you earlier today. You're on mute, Ruby, if you're speaking. All right. We will go to Daniel. And you're on mute, Daniel, if you're speaking. All right. We will go to Kelly. And you're on mute, Kelly, if you're there. Kelly Flowers. All
Hello,
right.
everyone. Kelly Flowers. I'm a Women Leading Technology. What we do is we help young girls to be able to find their passion so they can live in their purpose. And so they never work a day in their life because they'll be doing what they love. Hopefully, we'll have some girls that will be actually exploring artificial intelligence. Right now, they're focusing on like 3D printing and different things like that. And we are also building houses, which are tiny houses for the unhoused college students. Unhoused, believe it or not, is unhoused college students here in the United States. So unhoused college students, as well as unhoused single moms and veterans. And so that's what we are focusing on. And we want to be able to service them. And, hopefully whenever they're needing healthcare, we can send them your way. Thank you.
Absolutely. Hey, make sure you all drop all your content in there inside of the information so they can connect with you. The next person, I have Nima. And Nima, after Nima, Cesar, you'll be up next. Daniel and Ruby weren't available, so Nima, you're up.
Yeah, thank you so much. My name is Naima Mleli, and I am the Executive Director for Global Chamber Tanzania, but also I'm the Vice President of African Women in Herbs and Spices, and also the CEO and co-founder of Integrated Empowerment Initiatives, which is an NGO that is registered in Tanzania, and we work with youth, and right now we are having a very great program for Rise Up leadership program for youth and also women to expand their markets globally. Thank you so much.
Thank you. I forgot Jemima. Jemima, I missed you. You're up next. You want to introduce yourself?
Hi everyone, I'm Jemima. I'm the marketing here in Global Chamber. So if there's anything like you have upcoming events that you would like to do with Global Chamber, feel free to reach out to me at jemima@globalchamber.org.
Jemima is our backbone. She makes it happen. She's our dream team. We appreciate it. Say so, and Elias, I hadn't forgot about your question. I'm just trying to get the introduction then. Cesar is our VP of Operation of Global Chamber. He is phenomenal. I'm gonna allow him to introduce. Did he leave us? Oh, there he goes. Allow him to introduce himself. Hey there, Cesar.
Hey, Stephanie, thank you. And thanks, Dr. Keva, for the presentation. It's been really, really great. Well, Cesar Trabanco from Global Chambers headquarters, and I'm mainly supporting our members with connections and opportunities and helping our global team as well with the growth and expansion. Happy to connect anytime.
Thank you so much. Thank you again. So real quick, we have 4 minutes and I have 2 slides I want to share. Dr. Kaba, the question that Eli asked is how to leverage the use of technology to increase enrollment in health insurance schemes to achieve UHC. What is UHC, Elia? Just put that in the chat real quick, what UHC is. Or you can say it, that's fine.
Universal health coverage.
Oh, universal health coverage. Okay, well, there you go.
Yeah.
All right. So Dr. Kaba, can you answer that in 1 minute or less?
Yeah, very quickly, investing AI technology, individual can better manage their finance and also the potential lawyer, their out-of-pocket expenses, because if you want to go to the hospitals in our context, you need to pay the transport from home to the health emergency services. At the door, also you have to pay at the entrance. When you go inside, you have to pay lab. You have to pay the doctor. You have to pay many things at the same time. So this process can really impact patients about expenses, so that AI technology can reduce or eliminate those expenses. Like there's no transportation fees when you use AI. Then you are directly in face of your doctors or physicians. Then your physician can directly prescribe, and then you go to the pharmacist. You don't pay the transport. There's no unnecessary travel trips, unnecessary trips. So there's no cost related of that. There's no cost of paying at the entrance. There's no cost. So that is why investing this component, we don't have enough time. Investing, the government has really changed their policies and prioritize AI technologies and virtual care that will really help people and reduce out-of-pocket expenditures that we are facing. Thank you.
Thank you so much. Thank you so much, Dr. Kaba. We really appreciate you agreeing to be our presenter today, talking about the changing face of healthcare and how that will impact providers and teams. I just want to share again about Global Chamber. Global Chamber, this is what it's all about. You have people all over the globe, all over the United States, all across the pond, different countries, and we're able to connect and do business with one another, warm connections, not calling, and just getting to know one another personally. And that's just been great. I just met Laura today, her and her husband, and I'm like, oh, I love them, and she's in London. So I met her today at the Global Chamber London meetup this morning, and that's how I just met her, and she joined today, came over here today. If you're not a member of Global Chamber, if you would like to be, it's not a push, not a sell. It's many benefits. I have on the screen, you see the QR code. If you have more questions, you want to get to know more information, please feel free to reach out to me. I'll be more than happy to let you know. There's some upcoming events that I just want to share with you all, just so you can be aware. Global Chamber also has a book club, a book author club. We have lots of authors in Global Chamber. So remember, I told you we're in 525 metros, 195 countries. We have hundreds, thousands of members. And members who've written books or about to write a book or want to know how to write a book. So we do have our workshop coming up on the 18th, which is tomorrow and Wednesday. We have a Global Women Online Networking. Women, let's get together, hear from one another, learn from one another, the do's, the don'ts, the aches, the pains, the frustration, celebration. Join us also there on Wednesday with Global Chamber. That's at 8 Pacific time. You see the time. We have a virtual League of Opportunities that's also coming up. That's on the 19th. We also have a virtual League of Opportunities for nonprofits as well that Jacob leads out. And then we have our Global Monthly AI series that's on the 19th. That's on Thursday. And that's also led out by Jacob. So I just want to say thank you all so much. I hope this was very beneficial. Please know that 2025 is going to be hot. We have some fantastic topics that we're planning on. If you all have topics that you want us to address, you know, by anyone in the healthcare industry that wants to be a part of the panel discussion, please reach out to me. I'll be more than happy to get you on board. But we are very excited about what's about to happen in 2025, and we want to see you all there. Thank you guys again, and we really appreciate you all.
Thank you.
Thank
you, everyone.
Take care. Bye-bye.
Bye.
Bye.
Bye. Take care.